More than 200,000 Arkansans get their healthcare coverage from Medicaid Expansion. In Arkansas, that's known as our home. And we've gotten some concerning news. People may have seen the headlines. I've got Ashley Hudson here, state representative representing parts of Little Rock, to talk about exactly what's going on and help break this down for us. Thank you so much for being here today, Representative Hudson. How are you?
Yeah, I'm good. Thanks so much for having me.
You have been doing a great job covering this online and helping people understand. I know this is really your area of expertise, so I'm so excited to talk to you about it. Right now, can you just break down for folks who may not have any idea what our home is or what Medicaid expansion means? What exactly was rejected? What exactly is going on right now?
Yeah, so our home is Arkansas's answer to Medicaid expansion. It's been called a number of different names over the years. But this is basically the health insurance through Medicaid for people who make too much money to get on traditional Medicaid or maybe aren't disabled or qualifying in some other way. But also are still, I think, only up to 138% of the poverty line. So they're still not making very much money. And so they're able to, in Arkansas's case, purchase their health insurance through the exchange, and Arkansas pays for that through the Medicaid expansion plan. Not every state does Medicaid expansion the way that Arkansas does. Every state was allowed to either do a traditional Medicaid fee for service, which means that they just had people who qualified for Medicaid expansion just get on traditional Medicaid. Some of them did. Some of them did managed care, so they went with a managed care model. And then Arkansas was really kind of a trailblazer at the time, back in 2013, when we decided to do this, allowed the participants, the beneficiaries, to purchase their own insurance off the exchange, and then Medicaid pays for it. Now, in order to do that, we had to get a waiver from the federal government because it's not part of the traditional Medicaid program, right? And the rule with waivers is that they have to be budget neutral. That means that the government will not spend more on your waiver than they would have on traditional Medicaid. So historically, we have reapplied for this waiver several times since 2013 with no problems. This time, however, the federal government said, nope, this is not meeting budget neutrality, which doesn't surprise anyone, I don't think, given how much health insurance has gone up in the past year. And so they've said this program is going to end on January 1st of 2027 unless some other action is taken.
So, what does that mean for the 200,000 Arkansans who rely on this program for their health care right now? If it come January 1st, are they going to be without health insurance? What happens for them?
So what the government has told us is that if we get to January 1st and there's no action taken by Arkansas, then they will automatically move people who have a Medicaid expansion plan onto a traditional Medicaid plan. So no one is going to necessarily lose their health insurance on January 1st, even if we take no action. However, there could be some significant changes in how that health insurance is applied, what kinds of providers are in network, and so on. And one of the problems that's always been present with Medicaid programs in general is that the rates are very low. So sometimes there aren't as many providers who are participating in the traditional Medicaid program. So there may be changes like that. And all of that assumes that we don't do anything at the state level to either reapply for a new waiver or come up with an entirely new plan, something beyond what our home has been.
So, speaking of that, of like what's the alternative to this? What kind of conversations are you hearing in the legislature? What kind of plans are being made to be able to answer this? Because it sounds like even if they wouldn't lose their health insurance coverage, people could still see some impact. They might have to change providers. They might have less reimbursements. I mean, that it could still have a real impact. And we'll talk about this a little bit later, but also on hospitals and providers just being able to stay in service to people who maybe don't have Medicaid. But first, let's talk about what the legislature or the governor are looking at as ways to keep this in place for people.
So, what I've been hearing, and I think this part is right, is that likely the our home model is dead. And even before this news, when Centene pulled out of our marketplace a few weeks ago, the writing was on the wall because Blue Cross Blue Shield was the only provider that was continuing to provide plans on our marketplace. And so it became clear that this model was no longer sustainable. So we knew that that was kind of coming. And I think when I hear that from DHS and from other colleagues in the legislature, I think that that's right. What it means more broadly, though, is the area that I'm most concerned about. Because even if we went with a straight Medicaid fee for service plan, at least we would ensure that these 200,000 Arkansans had coverage of some kind, even if it was different than what they have right now. But there are a few of my colleagues who have not only traditionally run on getting rid of Medicaid expansion, but who have made comments over the past few weeks saying that they think now's a great time to do that. So that would require proactive legislation that says that we're getting rid of Medicaid expansion. So it would be just a total elimination of the program. In which case, we would be in kind of a crisis situation. I don't know how much momentum they have on that. I think surely that data and numbers, especially in these rural areas, would have to persuade a legislator thinking that way about the devastating effect that could have on their community and their neighbors. But it's not completely off the table. So, I think that there's an opportunity here to do something again that's creative and innovative and distinctly Arkansan, much like they were able to get done in 2013. I just don't know at this stage what that's going to look like when it comes out on the other side.
Okay, that's helpful information. So in that case, if they were to say no, we don't want to continue this Medicaid expansion, what you say that's devastating for not only the people who receive their health care through that, but what does it mean more broadly for folks who maybe have never received Medicaid in their life? What this means for them going forward if this were to go away for our state?
Yeah. So, I mean, one thing before that, I've had a few people tell me, well, Medicaid expansion is required, so Arkansas could never get rid of it. That's not true. Go ask Tennessee how that's going for them because Tennessee doesn't have Medicaid expansion. There are several states that still don't have it. But I've been talking about the fact that the healthcare system really craves stability. So when you have a disruption in any part of the healthcare system, that can disrupt everything else. It's a ripple effect throughout the system. One of the reasons that Arkansas has been able to maintain a relatively strong rural hospital system for as long as it has is because we were one of the first and still one of the few rural state or southern states that engaged in Medicaid expansion because that ensured that hospitals were able to get reimbursed for the services that they provide. There were less uninsured people, less underinsured people. And that also means that people in those areas are staying healthier. They can go to the doctor more often. They can do preventative care. And all of those things matter. If you don't have health insurance, you're not going to go for a checkup, or you're not going to go if you're feeling a little bit ill. You're going to wait until you're very sick before you go in and see a physician. And likely you're going to go to the ER. So if we get back into a situation where fewer people or all 200,000 of these Medicaid expansion beneficiaries no longer have insurance, then what you would see almost immediately is a massive disruption in a system that, as I said, really likes stability. You would see more people coming to hospital ERs, which is longer wait times for everybody that wants to go into an ER. You would see situations in which hospitals would have to start thinking about closing programs, or some of these hospitals would have to consider closing entirely because when somebody comes in and they don't have health insurance, hospitals don't turn them away. They just don't get paid. And so that uncompensated care costs would start to really go up, which causes disruption to everything. It trickles down to everything. It's the only thing that trickle down economics really works for, right? Because it trickles down into the clinics that are associated with the hospitals, the providers who work in those clinics, and all the way down to the very base PCP level. That also affects, though, the entire community. Often hospitals are the largest employer in a community. And so if you're looking at not just the healthcare impact, but the economic impact of having hospitals starting to close in these rural areas, you can see where this one change could really have an expansive effect on everything from healthcare to education to economics in Arkansas.
So for folks who are hearing this, it sounds like the people who can really make change are you and your colleagues in the state legislature. And you said there's really not a broad consensus, it seems like, yet on what that's going to look like exactly, that it may be something completely new. And there may be people who just oppose it. For people who out there who are maybe not all that politically plugged in, but are concerned about their health care or even just healthcare costs in general, what kind of questions should they be asking their state lawmakers right now? Because, I mean, a lot of y'all are running for reelection. Elections are coming up in November, and then everyone will go into session after that. So this is an issue where people's votes really matter on this issue specifically. So, what kind of questions should people be asking when they're talking to their lawmakers about this?
Yeah, and I would mention too, I mean, part of the reason there's not a lot of consensus yet is because we're not in session. That's a really good point. We don't go into session until January, and the governor has expressed that she doesn't see any reason to have a special session on this issue, which I disagree with her about. This seems like more of an emergency than FOIA, and we had a special session about that.
Let's
Um,
let's let's talk about that a little bit more before we go on to the lawmakers.
yeah,
What do you think, like, what's the logic there? Like, that doesn't seem to make any sense to me. Is this just political posturing? Or, I mean, I know you can't necessarily say for sure, but the exactly what you said. We had a special session for FOIA. We could have a special session for tax breaks, but we can't have a special session for healthcare emergencies. How does that make sense?
I think it only makes sense if you are looking at it from a purely political and cynical standpoint, which is the governor does not want to run for reelection, being the Republican governor who saved Medicaid.
Got it. Well, that makes, sense if you don't care
I
about
mean,
people all that
yeah,
much,
it's just it's a line on a mailer, and that's the cost benefit, I think. And I could be wrong. I hope I'm wrong about that, but to me, that's the only thing that makes sense, because why wouldn't we be thinking about a crisis affecting 200,000 Arkansans more urgently?
So is that the thing that people should be asking when they speak to their legislator, trying to push them to get the governor to call a special session? Or is that probably a no-go and there are better ways to kind of, leverage your individual power or individual, like, political influence when you speak to your lawmakers on that kind of issue?
I always tell people that if you are looking to engage, then by all means, if that's the way that you think that you want to engage, then do it. I'm not going to tell people how to interact with their lawmakers, but I think too, people who aren't necessarily always politically involved, now's a really good time to start at, getting politically involved. And so it starts with looking up and figuring out who your lawmakers are. A lot of people, a lot of really smart professionals and moms and dads and all all these people don't know who their legislators are. I get calls all the time confusing me with a congresswoman. People don't know who their state legislators are versus their federal. So the first thing I would do is say, just do a Google search, find out who your state lawmakers are, and reach out to them. People are always surprised when they reach out to me that it's my cell phone that's on the website, and so when they call me, I answer. They think that there's staff, and there's not really staff at the state level. So it's really easy to engage directly with your legislators. So I would take this time to find out who that is, reach out to them, introduce yourself, and start asking them, what do you think about this? What do you think about losing Medicaid expansion? What do you think our plan should be? And if they have a personal story, they should share that with them, because I always think that's super compelling. But a lot of times, and I think it's just because people think that it doesn't matter, we don't hear a lot from our constituents on issues that are really big deals. And some of my colleagues will gauge whether or not they think something is a big deal based on whether or not they've heard from anybody about it. So don't be afraid to reach out to any of us. We work for y'all, right? So this is the time to start that conversation, because come January, often most of the decisions have been made. And so now is the time to call and ask, what are you going to do about this?
Yeah, absolutely. And before we wrap up, I want to remind people, because they may not know this about you, when we talk about how important every vote in elections are in the state legislative race, can you
Yeah.
remind people how close your first election was?
24 votes.
24
24
votes.
votes. 4 lawsuits, a couple of, several ballot challenges later. Yeah, so every vote counts, and it was fun. In my first session, I would meet people all the time, and they'd be like, "I was one of the 24 votes," because everybody took ownership of that. And so I had probably 1,000 people tell me they were one of the 24. But yeah, it matters. Representative Joy Springer has won an election by 2 votes before. So at the state level, it makes a huge difference whether or not you sit it out. So don't go to the top of the ticket and then leave everything else blank, because it's those lower races that often can be decided by, 1 or 2 or 24 votes.
Absolutely. Anything else that folks need to know about this, or anything you want to leave people with as we move ahead on this? I know there's a lot of issues you're working on. I know it's been a very busy week, but anything that you want folks to hear before we wrap up?
I think right now, I don't want anyone to panic. It is really scary to think about not having health insurance or not being able to get care for your kids when they're sick or whatever. I don't want anyone panicking right now because there are still lots of things that have to be decided, and lots of steps to go through to figure out what we're going to look like on the other side of this. So I don't want anyone to go into the next week thinking that they're about to lose their health insurance. And I and many of my colleagues, Republicans and Democrats alike, are committed to trying to get this sorted out and fix it so that people do not lose coverage and can feel confident that they have coverage going into the new year. So don't panic. Know that we're working on this. Know that we are going to do everything we can to protect you and your family, and just stay the course. But definitely reach out to your legislators.
Thank you so much, Representative Hudson. Appreciate you and everything you're fighting for, not just on this front, but on many fronts here in Arkansas. Thank you for taking time to talk to me.
Yeah, thanks so much for having me.